One of the benefits of being part of Encompass Health is our interdisciplinary team. So nursing fits into that team in a very important role in keeping the patient ready to go to therapy, keeping the patient continuing those pieces of their therapy regimen that they need to have outside of therapy. Therapy treats the patient at least 3 hours a day, and we have the patient the other hours of the day. That means we keep them comfortable, we make sure that their pain is controlled, we make sure that they eat, they stay healthy, they go to the bathroom, all of those things. We're taking care of their skin, we're managing all of their medical issues. Our population of patients is very sick usually and has a lot of medical things that we have to take care of. So it's a very busy style of nursing, very physical nursing as we're getting our patients up to the bathroom, we're getting them dressed every morning. All of those things are involved in rehabilitation nursing. So nursing is a very vital part of that interdisciplinary team.
I was interested in the fact that when people come to Encompass Health for rehabilitation, they're getting a lot of therapies, and I love the idea of watching people progress and get better and trying to really get them back to their optimal health so they can return to their lives and just enjoy their life being as healthy as possible.
So being part of us is really a unique experience. Encompass Health has the ability to provide a ton of data. So you have resources where you can look at a patient, an issue that's going on, and see which hospital is doing the best at that. So because of our vast electronic record and lots of patients doing the exact same thing, we can pull all that data together and you can compare what you're seeing at your hospital with another hospital. All of the hospitals in our system. So looking at more than 140 hospitals doing the same thing that you're doing and see, wow, this one hospital is doing so much better than I am in my hospital. How can I get that same outcome? And you can just pick up the phone and call them and say, can you tell me how you're getting that outcome? And so that is an amazing thing as a nurse leader or just a staff nurse to say, hey, my nurse manager, my CNO, can we call this other hospital in our system and see how they're able to get those outcomes? So it's pretty exciting to see that you're comparing your apples to their apples and then being able to figure out how you can get those same outcomes. So that's a pretty neat ability to do that. We're all on the same team. We all do the same things. We're all a little bit unique in our hospitals. It's not absolutely cookie cutter, so you do have some autonomy to do that, but you also have the ability to look at other hospitals that are like you and see how you can improve your own hospital. In Encompass Health, when we take a nurse and we think about their career, there's so many things that we can help with. That's one of the things that we focus a lot on, taking nurses from being an LPN to helping them get their RN. We have connections with universities that give them tuition reimbursement to further their career. We have that even from getting an undergraduate degree to getting a graduate degree. We also have Nursing Leadership Academy that trains the managers in their leadership and supervisory skills. We have individualized plans that help them develop and grow. So we really can help a nurse grow along their path. And we have many nurses that have started with us as a tech and developed all the way into being a CNO and gone through the years in our company. You can also grow throughout the nation and go from one side of the country to another. So if you have the need to be from California, you want to move to Florida, you can do that with us. So we have the ability to really work with you and help you grow and develop and learn, and really it's an endless track with us. You can definitely do a lot of different things, and we can help you with that.
Well, I've grown with Encompass Health. My first job in healthcare was actually as a rehab nursing tech on the 3 to 11 shift when I was in nursing school about 20 years ago. I went to acute care and then I returned as a nursing supervisor. When I worked as a nursing supervisor, I was strongly encouraged to get my ARN certification, and I also was able to participate in some leadership training. I attended Nurse Leadership Academy for nursing supervisors, which is a program specifically for supervisory level employees. I went on to take the Chief Nursing Officer position at the Tallahassee location, And while I did that, I obtained my master's degree from Florida State University and then my doctoral degree from Duke University. And I really attribute being able to grow with the company to the mentors that I had over the years. I've had many mentors. I continue to have mentors that really pick me up when I feel down and encourage me. And I think that that's something that Encompass does a really nice job with.
The Encompass Health programs that I have used to support my career growth are the tuition reimbursement program. I actually use that to obtain my bachelor's degree in nursing, and I also use it to obtain my MBA degree in business. I also use the student loan repayment program. So Encompass has a program to where if you have past student loans or if you have to utilize a student loan, they'll pay a certain amount every month on your student loan payment to help you pay the student loan down faster. So I've utilized both of those programs.
So they have the learning portal here, and a lot of that stuff goes towards your continuing education units that you have to obtain every 2 years. All that's free. They make sure that you stay on top of your BLS if that's something you need to do. They have all the resources for you to do that here at the hospital, and also for your ACLS if that's something that you want to do. They have all the resources for you to obtain that here as well.
When I started working for Encompass Health, I was just a registered nurse. And with Encompass Health, they helped me to get my BSN through a partnership they have with Chamberlain University. That is great, because one of my goals is to not just to help the patient, but to grow as a nurse. So when they tell me you have the opportunity to get your BSN, which is on a step forward in your career, or they say, we haven't specialized, you can become a certified rehabilitation registered nurse, and they're gonna put you on a step forward too. And they say, we don't only have that option, we're willing to help you to get that.
Encompass Health is a strong supporter of their nurses getting the CRRN certification. Our CRRNs are highly trained in disease processes related to rehabilitation. They're also highly trained in theory of nursing and also treatments for rehabilitation patients. They're a huge resource. They serve as a clinical expert to our teams, and our patients are very fortunate that they have around-the-clock 24-hour nursing care with CRRNs on board.
The value of having CRNs on our care team is the specialty that they bring. So not just an average staff nurse, but a staff nurse that has taken time to specialize their skill set in rehabilitation nursing. So that means they know more about bowel and bladder issues. They understand the significance of a stroke on the ability to provide care for yourself, how it impacts the brain and the way the body works. They understand all of those things. So they bring that to the care at the bedside, as well as things like performance improvement teams and disease-specific certification teams. So they have that extra specialty assigned to them by their own initiative. So they sought out that certification. And I'm very proud of the numbers of CRNs we have. We have over 1,900 CRNs in our company. And so that really sets us apart as having that vast specialty practice within the space of rehabilitation nursing. Our CRNs are usually tapped to precept other nurses, to work in performance improvement activities, to lead the charge in solving problems that we may have. We had a project a couple of years ago. We were looking at bladder training for our patients when they came in, and we used a lot of our CRNs to kind of look at that situation. How could we make that better? Because they have that extra special skill set. So we use them and tap them on those projects that really relate to rehabilitation nursing at the bedside, and we get them involved in those types of things. So nurses can be nurses, which is great, and I think that's the predominant role that a nurse at Encompass Health has. But then our nurses also do lots of other things. Our nurses are case managers, they are PASS coordinators, they are CEOs, they are quality directors, they're infection preventionists, they are wound care coordinators, they're vice presidents of nursing, they're regional CNOs, they are any number of things. Nurse managers, of course, nurse supervisors. So there's a number of things that nurses can be within our company.
I've told numerous people, I have no plan to leave. This is where I want to be, and mostly because I do have that potential for growth. There's so many different jobs that you can do as a nurse, as it is, but in this hospital alone, like they have so many different paths that you can take and move forward with your career. And they're completely open to you, taking on those changes and doing what it is that you want to do with your career. And I love that about this place. I was training for the supervisor position, and I'm hoping that that's my next step, is to, when there's a full-time opening, that I can take on that role.
I work on the night shift, so I don't see a lot of the therapies during the day. So I hear about that from the patients. The patients kind of fill me in as to how awesome the therapy is. But we do have a wound care nurse. She has agreed to work some night shifts. So she collaborates with us, and she really has shown us wound care and helps us with documentation. So I love that collaboration, because we all come together to give our patients the best care we can.
CRRNs perform a variety of roles in our hospitals. They are bedside nurses, hospital educators, wound care coordinators, infection preventionists, nurse leaders, nurse executives. And that's valuable because it really showcases that we have a holistic approach to treating our patients, and we want to have that expertise at all levels at our hospitals.
For me, my goal is, I'm right now a bedside nurse, and I love it. I'm learning something new on every shift. I learn from all my coworkers. Everybody's been so supportive, but I feel like eventually I'd like to move into some case management, and that's what I've talked about. I like that connection with people, and I like the idea of maybe having more one-on-one time with patients and their families, and they've been really supportive of that goal.
I think the neatest thing is that when you start out as a nurse anywhere, and I've done this because I've mentored, I've been, able to precept from that aspect of it. It's life, it's right and left turns all along the way, and no one way is the best, and you evolve over the years. So going from being an RN, and I was in one of the first medical facilities that was a medical school in North Carolina, East Carolina University. So you're a lot of young, professionals, but then going from there, is in public health. So it's, again, my track has always been more community-based, probably more than anything, in all the different facilities or organizations that I've been with in healthcare. And then really tracking in the last 15 years within the home healthcare setting, and didn't know it as well, learned a lot about Medicare and guidelines, and then becoming also a home health care director. That really made a big difference when I was interviewed to come to Encompass Health, because there's so many things in as a nurse that you never taught or you don't know about community. And we are, going to look at what's our goal here. We want those patients to feel like they can go home and be successful at home. Well, that starts back to what I was doing before. And then coming here, the last 5 years, having great mentors. A lot of the case managers I worked with over at Largo, at that location, they were RNs or they were case managers for many, many years.
With Encompass Health versus being an acute facility, you get to see your patients come in and then you get to see them leave, and the amount of work that they put in, and you get to see a really amazing progress, and you get a good rapport with your patients. You can talk to them and you have the same patients. I know 90% of the patients here. So I get to work with them on a day-to-day basis, and just, you get to know them and specialize their care based on them. You can joke with them, and it's awesome because you get to see them transition to going back home and living their life in their new normal.
My first day was amazing. So from the first day on, it was very clear that leadership cares about their employees. They took the time to get to know us, or get to know me, and find out that I am in nursing school and that I have that goal of becoming an RN, and then help me accomplish that goal with Encompass Health here. And everybody's just been so welcoming and so open with each other, and very supportive.
The positive culture, the support, the flexibility in scheduling yourself. They listen to you, they care about your personal life. I've experienced that from very early on, that I had an issue with my family, and it was a personal issue, and they were extremely supportive. They were like, you need to take care of that. I didn't have to worry about my job. I knew that they cared, and when I came back from that experience, they asked, how is your mom? So it was just makes you feel like I'm in a really good place, and I would like to share that with my friends. You want to come here and work because it has been such a positive experience, and they care about you.
I was really surprised by how well the team works together, how there's really good teamwork between our therapy department, our nursing department, working with our doctors to achieve just the best outcomes for our patients. Everybody pulls together and really tries to work together to get our patients better and get them home, basically.
Collaboration here is hands down the best. It's one of my most favorite parts about working here. If I have a patient that goes down to the gym and they're working with PT or OT, they will come back and tell me anything I need to know. Anything that happened, any kind of change from their normal or anything, like now they can do they went from a max assist, which is 2 people helping them, to now they only need 1 person to help them. Everything is very fluid here.
I love this facility. I love management. I love my chief nurse, and most of all, the staff that I work with at night. I could be in a room and come out and I'm looking for somebody and I need you to come help me. I don't get, Miss Joyce, that's not my patient. Let me go get somebody else. They just don't hesitate. They just come. And that feels good to me because they know that they are responsible for a certain amount that they're taking care of. But they're all our patients.
I would have to say that, especially speaking for here, because this is the main hospital that I work at, our Encompass Health, we have such great support from people higher up, like our directors. They're all very hands-on, they're all very supportive, they're willing to lend a hand, they answer call bells. People say that they're gonna do that in the hospital, but they don't. They walk past the call bells. They don't do that here. They help you. They do anything they can to help you. And I think that that's huge for a nurse to know, is you're gonna have the support here. We're always having fun. Like I don't feel like there's very many stressful days here. It's just, if it gets stressful, somebody's there to help you. There's somebody there to try and take some of that load off. So I feel like we're fun and we're caring. Everybody's got each other's back here.
It's interesting because I was a little bit nervous about night shift, but it's been great. We get to self-schedule, and so that really gives you that flexibility to look at your life, to look at events that are coming up. They've been so supportive of my schedule. And you basically work 3 days a week and you have 4 days a week to do what you want to do with your family and your personal life. So I feel like the balance is really wonderful.
Our specialized care really helps in the outcomes of our patient in the ways that knowledge of what a rehabilitation nurse needs to do. So things like making sure that a patient at night gets all of the rest that they need, because we know they're going to work hard in therapy the next day. So not just simple, like you would in an acute care hospital, we want to make sure they're in their bed and they're safe. We definitely do all of those things. But then we also know the value of rest that they need. We know how much they need from a nutrition standpoint. We know that they need to have all of the pain medication and comfort measures in place so that they can do their very best in their therapy setting. So we really bring the patient up to the very best level they can be so that they can participate in therapy, have the greatest outcome, so that they can prepare to go home and really meet those goals that they have for themselves.
So the specialized nursing care puts us in a position to where, with accurate assessment and rapid intervention, we can make sure that the patient stay medically stable so that they can participate in therapy, which is the reason why they're in the rehab setting to begin with.
I think the biggest joy that I find is that being able to assist patients in going home, but realizing these are just patients who need that same support like I had with my mom and dad. I want them to feel just like I would if they were my mom or my dad in bed, you know, in that hospital bed. And it's scary. So it's the joy of knowing that we want to make them feel as comfortable, you know, as possible. So we want them to feel comfortable coming here, and I think that's probably my biggest joy, is finding that with people that I work with who are so progressive and so positive, you know, and then we transcend that into that care that we're giving, you know, to our patients. So
I would say I was actually pleasantly surprised at the complexity of the patients. You know, sometimes you think, when you think of an inpatient rehab, you might think more of like a nursing home setting, and it's absolutely not the case at all. The patients can be very complex, they can still be very sick, and you still get to be a nurse. And I know that that's what a lot of people think of. They don't want to leave the hospital because they're afraid that they're gonna be bored, and you won't be bored here. They're not here to live. This is not their home. This is a stepping stone between the bigger hospitals and them being able to go home. And we try to avoid, you know, them going to a nursing home. Our biggest goal is to get them back to their prior level of function. We want them to regain that independence. And it's great to be a part of their care, to be able to do that. It's great to be able to watch. We had a patient that came in, and you're supposed to assess them on the day they come in, see how they stand, see how they roll. That's part of every admission. He could barely do any of it. I only had him on admission, and he also had a lot of wounds, which is always hard because they're difficult to heal, especially when we only have them for a couple of weeks. I had him again probably like a week and a half later, and he was about a week out from going home, and the change was drastic. He was standing, his wounds had healed drastically, like they were pretty much completely healed, and he was beginning to walk, and he could go to the bathroom, and like all these things that he was not able to do for so long. He was in the hospital for so long, and it only took less than 2 weeks for him to get there. It's like our therapy team, our nursing staff, our wound care coordinator, our nutrition staff, everybody works so well together as like interdisciplinary team to really make sure that these patients get the best care possible and get to go home. It's like indescribable. And I told him like how proud I was of him, and I told his daughter, I was like, this is amazing. Like, I don't think that they realize like just how amazing they are when they do these things. Like, I know it's a lot of us, but it's them too. If they don't put in the work, you know, they're not gonna get as much out of it as they would, you know.
I had a patient that came here from I would say South America or Central America. I can't exactly remember the spot. And he did not speak any English. His wife spoke English, but at that time we were going through COVID restrictions here. It was right when we first opened, and she was his everything, and she wasn't allowed in. So he went through brain surgery. He was having panic attacks, and I could see it just checking his vitals and assessing him. He was the sole provider of his family, and he was worried about how he was going to be able to provide for them back home. And he was now blind on his left. He was blind in his left eye, and he didn't have any movement on his left side. So I would call his wife and try to talk to her because she spoke English. So she would talk to him, and they would go back and forth, and then she would tell me what was going on, and I went through everything with her, and I was like, I'm gonna go try to find a way to get you inside, because he couldn't participate in therapy because his heart rate he was so tachycardic, he was a risk for therapy. So I went and sat down with Amy, our CNO, and I cried like this. And we got her able to come in, and he was with her here. It motivated him and it got him back home. And honestly, he was one of the fastest timelines here. He went home within a week, and he was able to walk, which he wasn't able to do. And it was just awesome. And he went back home.
I have so many proud moments with Encompass Health. I've worked for the company for 27 years. I've been in this role for 15 years. So I could narrow it down to a couple of things. One, I think increasing the number of CRNs in the company to over 10% of the CRNs within all of CRNs that exist. That's a very proud moment. I think I always have a proud moment when a nurse comes up to me and tells me that they were able to go to school because of funds that we provided as a company, and now that they've gone from being an LPN to an RN, and now they're getting their master's degree and they've advanced their career, and they are committed to being a rehabilitation nurse, because I believe that this is the best practice that there is out there. Seeing patients get better and go home and be able to be with their families. You just can't get better than that. So if we can do that as a company and we can provide an environment for nurses to thrive and grow, you just can't get better than that. So that makes me proud every day.